Thanks. I'm Justin. Interestingly, like Tim, I had an EMS background and really thought about EM as well, but ultimately decided that I have a lot more fun working with kids and the adults don't like my jokes as much, so I really wanted to go the peds route. Um, but I think there's like a couple of things that I really want to highlight. I also picked health policy and systems management for some pretty similar reasons. I think a lot of my interests are in kind of healthcare delivery and how we can improve systems and be a little bit more patient centric and really look at some problems that kind of face the healthcare system. And instead of saying, why aren't patients doing this, frame the question more, what can we do to support patients to receive the care that they need? And I think in thinking about MPH, really medicine or medical school is going to provide you with outstanding training pretty much no matter where you go to answer the question, what's the diagnosis for this patient and what's the treatment? I think the third question that public health really helps you start to answer is how can we make sure this patient can access this treatment and engage with the treatment? And I think that's a piece that can be missing from standard medical education. That's really the edge that you get in this training, but also an edge that translates into things like residency applications. Just like Tim, everyone that I have interviewed with has wanted to talk about public health. It is a huge selling point for residency programs, and I'm quite sure that I've gotten much better interviews than I would have without this level of training. And then just a couple of things, because I know that you all are also considering probably multiple medical schools as well as potentially multiple public health schools. So I wanted to highlight just and looking around the country for residency options, some of the things that I think are really unique to the School of Public Health here and our medical school system that are things that you can evaluate and then look at this for other schools as well if that's kind of a decision point for you. To me, one of the really big ones for us is the partnership with LCMC, which is the Louisiana Children's Medical Center. They don't usually say that one, but Children's Hospital actually took over a bunch of the hospitals in this area. And we're partnered with a really, really strong healthcare system that has a lot of values that align with public health and is really doing some good work to work with and for the community in a lot of the care that they're delivering. And I think that permeates into that medical training and opportunities for public health. Some advantages to the School of Public Health, and particularly if you're doing an integrated program, really hard to beat the value. Whether or not you're in state or out of state, this is one of the best bang for buck MPHs that you can get. And the value of doing it at the same place that you do medical school is those longitudinal partnerships. I actually did the 5-year. It was a great way to take a break from clinical, but also line myself up for a couples match with my fiance, who was a year behind in medical training. So the other things that are really nice about our department is or the entire school. I mean, I love HPSM the most, but they're all great departments. The best thing about our school is it's kind of in that medium size. It's small enough that it has a really, really tight-knit feel, to the point where you could even walk into the dean's office probably most of the time, and he'd be happy to chat with you. But all of the faculty are super accessible and really interested in helping support your career. But it's also big enough that there are things like the Louisiana Cancer Registry and a lot of really great work on resiliency and the community side of health. And even some bigger health policy questions where we're part of multi-center things. And there's some really big names. Dr. Culbertson's way too modest to tell you this, but his name carries weight. And he's done some great things over the years. So you really have those benefits of some really big opportunities, but a really nice small feel. And you can get a lot of stuff done. So instead of somewhere where it might be hard to get a meeting with faculty, you can just like walk to their office, email them, text them. People are really accessible and really trying to get students involved and making that easy for you to kind of excel in building some extra projects. So that's my short, long spiel.